week, it is my pleasure to welcome Dr. Cecilia Mengo. She is an assistant professor here at OSU at the College of Social Work. She has her PhD in social work from the University of Texas at Arlington and MSW from Western Kentucky University. And today she's here to present on intimate partner violence and self-reported mental health symptoms among women seeking help from a police station. Please join me in welcoming Dr. Cecilia Mengo.
Wow, so thank you so much, Aiden, and thank you so much, everybody, for being here today. As Aiden mentioned, I'm an assistant professor at the College of Social Work, and I've been there for 1 year. I moved here from University of Texas at Arlington, and so today I want to share with you about a study that I conducted last year, for the last 4 years that I was there at the University of Texas at Arlington. And the topic of my presentation today is intimate partner violence and self-reported mental health symptoms among women who are seeking help from a police station. So before I begin with my, just sharing my findings from that study, I want to share with you a little bit about my journey and what really interested me in looking at this topic. So I'm originally from Kenya. I was born and raised there. And while there, actually, I lived in the rural areas of the country. I don't know how many of you have been to Kenya? Oh, that's nice. Okay. And so just growing up as a woman, I saw a lot of challenges that women experience, especially living in a patriarchal society where women are not given a voice or even a platform for them to be able to participate in different activities within their communities. And also myself, in my family, I had also experienced such things. And so I pursued my undergraduate studies at Moi University, and while there I studied human geography, and I just wanted to be able to get more experiences in working with communities and engaging with people. And so when I got my first job, I was of course very excited as a very young professional and thinking that I have all the solutions. And so I worked with the United Nations. I worked with different non-governmental organizations. And the project that really excited me and where I got really to engage with people in the grassroots, and especially women, was with the United Nations Industrial Development Organization. And in this project, my role was to coordinate community activities, engage with women, and bring women to really work as self-help groups where they can share their ideas. And so while doing this, I just realized that there are so many challenges that women experience when they are working to provide for their families. And these include even getting permission to participate in meetings, even being able to be there is not that easy. And so, and while there, they shared with me some of the things that they experience, and that includes their struggles with sexual violence, their struggles with physical violence, coercion, and just things that happen in their families. And so for me, it was really an awakening call that when we are thinking about even engaging with the communities, especially grassroots communities, we have to begin by listening to them more and seeing some of the challenges that they experience, even being part of that, being part of that platform and being part of that change. And so that's how I began getting interested in the area of the social problem of domestic violence, as well as HIV and AIDS, because that also came up a lot, where families are so impoverished such that they have to engage in different sexual activities such as prostitution for them to be able to provide for their families. And so I got very interested also in getting more skills to be able to work with groups, in any kind of groups, and that's how I came here to the United States to pursue my master's in social work. And so I just want to begin by looking at some definitions. What is intimate partner violence? And it's always acronized as IPV. So intimate partner violence has been defined differently by different people. And most of the times, people define it just to suit what they are looking at at their research. But this is violence that occurs between intimate partners, and they could be married or not married. Others could be in cohabitation. And this is one of the most common type of violence, especially for women. And most of the times it manifests itself in form of physical and sexual violence. And we have different forms of intimate partner violence, as you can see there. We have physical violence, we have sexual violence, emotional abuse, we also have economical abuse, and some also that are not included there include verbal abuse. We also have economic abuse. Economic abuse is there. And we also have strangulation, which is emerging to be a very lethal form of violence, because what happens is that when somebody is strangulated, they are most likely to lack oxygen, and it could lead to death in the next maybe 5 or 10 minutes. So this is an area that is also emerging for people to seriously look at, especially for women. I just also wanted to look at some global statistics. As you can see there, intimate partner violence occurs in every country. But the rates at which it occurs in developing countries is more compared to a place like the United States. And every country has different rates, and this is because of the cultural aspects of that country, the socio-economic status. For example, when you look at Africa, the patriarchal society that is ingrained into the culture really perpetuates that and also increases the rates. But the different rates, especially in different parts of the country, of the countries, also shows that this form of violence can be prevented. If we look at the different contexts and look at what are some of the ways that we can, what are some of the strategies that we can use to prevent those rates from growing. In the United States, the rates are also very high. Statistics show that at least 1 in 4 women experience domestic violence, and I think that's a high number. And at least 3 women are murdered every day by their intimate partners, and we are hearing it in the news all the time. And sexual assault is also very common, and it's actually one of the most violence that is perpetrated against women. And it's also very common, especially for teenagers. In high schools, college students, sexual violence rates are very high. And this is also because of the culture that happens in schools and colleges that has been associated with alcohol. And also schools that have football, there's also a lot of perpetration of sexual violence. So it's emerging as a very significant problem among teenagers here in the United States. And children are always exposed to violence. They see violence every day, they experience it every day, and the psychological, physical consequences for domestic violence for children is very significant. And this actually carries over even to when they grow as adults. So these are just, I thought maybe I should share with you some of the major consequences of IPV. And these consequences actually vary based on the individual, the context they are at, and where they are coming from. For example, for women who are immigrants or refugees, based on their country of origin, these consequences could have more significance in terms of how they exhibit themselves in their lives, because some of those are coming from countries where they probably have experienced violence in the past or other forms of violence, such as war, terrorism, and things like that. So these consequences vary based on where women are coming from. So as you can see there, the consequences are immense and very significant. And in order for women to be able to deal with all this, they seek services, they seek help from a variety of programs. And most of the places that women go to are community advocacy organizations as well as shelters. And so these shelters provide them with different services, and that could include safety. Safety is one of the most important things for these women. Also help with their children, advocacy in terms of custody, because there are also custody issues with their children, transportation. And so these programs offer a variety of services to these women. Now, the thing is, there's not a lot of evaluation that has been done for these programs and their effectiveness in helping women get out of abusive relationships, or also helping women to improve their psychological well-being. And actually, many survivors of domestic violence would opt to stay in their marriage. They don't want to leave because it's very complex. They probably have opened different, they have done a lot with their partner, and they just want this to work. So the thing is, how can we have interventions that really look at empowering women from where they are with the resources that they have, and also looking at how would that look like because of safety issues. How would that look like if somebody wants to stay in a marriage where maybe abuse is going on? So there's not a lot of evaluations that have been done on the effectiveness of these programs. So I think it will be good to have more programs being evaluated and seeing what would be the outcomes and what can we, what can we increase, or what programs can we have that empower women from where they are. We also have better intervention programs. One thing also that has really, the thing is, when you look at many programs that are addressing domestic violence, there are like two movements. There are people who want to look at just women only, and also we have people who look at violence from the men perspective as an epidemiological way, because there is a reason why somebody is perpetrating violence. It could be some past experiences that they have had. They could also be having some mental health issues. So we have programs that also look at empowering men, and also creating programs where men can be able to really look at themselves and see what is it that leads them to perpetrate violence towards those that they love. And so we have psychoeducational groups that are going on in the Bachelor intervention programs for men. And most of the times, these programs emphasize on individual counseling, one-on-one with men, and taking them through that journey towards recovery also, because they could be experiencing some challenges, psychological challenges, or even economic challenges with their families that is leading to perpetrating violence. So we also have other programs like Futures Without Violence that works with fathers and engaging men in discussing domestic violence. And we also have bystander interventions that really put the responsibility to the public or to friends and people. So when you see something is happening, then you can stand up against that. So And we have one policy that has had a significant impact and positive impact in bringing down the rates of violence here in the United States, and also in helping introduce and support programs through funding that can help to respond to domestic violence. So Violence Against Women Act was enacted in 1994, and it was reauthorized in the year 2013 to be able to also include services for diverse populations like the LGBTQ, immigrants and refugee, undocumented immigrants. And this has really improved the service provision, including training the police or the first responders who respond to cases of domestic violence. So these are just some of the risk factors that really increase experiences with violence. One thing that I would want to mention here is that anybody can experience intimate partner violence. So it does not choose where you are from. But if you have these risk factors, the likelihood that you'll experience violence compared to other people is much higher. So, for example, women who are low income, financially insecure women, women who are less educated, ethnic minority women, for example, African American, Hispanic, Asian, and other ethnic minority populations. Young women also are most likely at risk of experiencing sexual violence most of the times. And single and separated women, because most of the times marriage is always looked at as a protective factor. And so protective factors are just opposite of the risk factors. So if you have all those resources, then you're more likely to be able to make decisions in your home and to be able to know what is happening to you and to be able to move out of that situation. Because some of the things that hold people back from staying in that abusive relationship is because you feel insecure. So if I move out of this abusive relationship, what will happen to me? Will I even be able to pay rent? So a lot of women just prefer to stay there. They would rather endure another beating than get out of that abusive relationship and not be able to pay for rent. So it's very complex, and so many factors are so intertwined that make women to just cope and stay in that abusive relationship. So when I looked at the literature, when I was conducting this study, and also just volunteering, because I volunteered at the Arlington Police Department when I was getting my PhD, I saw that there could be a gap. I know a lot of studies have been done, especially in looking at the relationship between intimate partner violence and its impact on mental health. But there's this population of women who are seeking help from the police station, because many women will not even want to engage with the police at any point, especially if they are married. So I thought there's a gap that is missing. There's some information that actually could contribute. I know it probably is not missing, but there's something that I could contribute into the literature by looking at this. And so that is one of the things that I wanted to address with this study. And also the way in which, the strategies in which women cope with that situation has not actually been explored a lot. Also taking into account that many women don't want to leave, they want to stay and be with their children and be with their husband. How do they cope with that process? So there are some studies that have looked at that, but it's still something that could contribute to our literature. And also the role of social networks and coping strategies that women use. For this population, it could differ from women in other populations. For example, women who are seeking help from shelters or community advocacy centers it could probably differ for these women who most likely have experienced severe and ongoing violence. I thought it would be good to be able to see if there are any differences in the way that this group of women cope. Yeah, and so the purpose of my study was really to examine some of the demographic risk factors, and the reason also that I wanted many studies control for demographic risk factors, and that could lead to loss of clinical information that would be very important. For example, knowing the differences in terms of race. So I wanted to examine demographic risk factors, intimate partner violence, and protective factors of social support and coping strategies, as well as economic resources and how these are related to the self-reported mental health symptoms for this group of women who are seeking help from the police. And so these were my research questions. And so the first one, I wanted to see the association of demographic risk factors and with IPV incidents, as well as self-reported mental health symptoms, and also how the type and number of incidents that women report is associated with mental health, and also as well as social support and coping strategies and their association with mental health. And so for this study, I had to really go back to myself as a person, where I have come from, and what really guides my research, what guides my teaching, and what guides who I am. And so empowerment is always a theory that really guides a lot of work that I do. And also because when we are looking at empowerment theory, it's looking at how women can improve their psychological and mental health well-being. And so in line with the philosophical underpinnings of empowerment theory, stress and coping theory, as well as social support theory, what these theories predict is that if women have resources, then they are likely to get out of that abusive situation, and they are also likely to increase their psychological and mental health well-being. So if they don't have those resources, then they are likely to have severe psychological distress that could keep them in that situation. And so this was actually my study. I reviewed case records of women who seek help who sought help between 2008 and 2015. And so there was a total of 271 women who had sought help. Now, the limitation with this is that I had to exclude about 109 case files because there was not enough information, or maybe they failed to complete the case files. And it was also very difficult to reach them to be able to get some more information from them. And so 162, and this includes men and women, had completed the assessment and had also come for a follow-up. I excluded 8 because they were male, and I was very interested in looking at women, and so my sample size was 154, the final sample size. And so my study setting was in a police department victim assistance program in Texas. And so this victim assistance program has actually been set up within the police department to only respond to domestic violence cases. And so all the women that come there, of course, have experienced violence. And the most important thing that they do is to meet the most immediate needs of these women. And so when women come, they refer them to different services or places that they can be able to seek further help. And during this time is also an opportunity for the victim advocates to be able to offer immediate counseling for the women who are coming there, because sometimes that could be the only place that they have reported first. So I was also volunteering there, just working with the women and also answering to phone calls and crisis calls, And I also accompanied the police in some of their crisis calls to respond to domestic violence. Yeah, and so this was exempted from IRB because this is publicly available data. But I also de-identified the case files just to make sure there's no identifying information. And it was very overwhelming with the data that was already there because they collect a lot of information. And so I had to create a data capture sheet that has all the individual variables that I was interested in looking at. And so these are some of the variables that I've shared, I think I've shared with you. So my main outcome variable was self-reported mental health symptoms. And normally what happens is that when a survivor comes, they check based on the symptoms that they feel that they are experiencing. And so what I did is that I created a composite score so that I could have a score of mental health symptoms. And these are some of the demographic variables: age, marital status, race and ethnicity, as well as financial dependence. And for the victimization variables, I had to rely on the description of the victim advocate on what they are describing in the case files as the person is experiencing. And I also corroborated that with the definitions from the CDC on how they define ITV, and somehow it was matching with what they are indicating there. It was a little challenging to also have the count of the incidents that women have experienced, but either way I was able to come up with that as well. Economic resources, that was the same. They check some of the resources that they have, their perceived social support, their coping strategies. And so I aggregated them together and created a composite score. I also recorded so that I'm able to know, by having a median split, so that I'm able to know who had fewer resources and who had more resources. So I also wanted to look at these variables, especially the empowering resources variables, as mediating variables, because according to the three theories that I shared with you, is that if somebody has these resources, they can be looked at as interventions. That if they have that, then they can be able to get out of abusive relationship or have improved their psychological well-being. So I tested these also as mediating variables. And so I used these data analysis techniques simply because, beyond bivariate and descriptive statistics, the hierarchical HRA and mediation analysis would also help me to understand how these variables relate theoretically. And so what I did also using hierarchical regression analysis is that I would enter variables according to how the theory also predicts that they impact, they influence intimate partner violence and also mental health. So I started with demographic risk factors, and then I followed that with some of the empowering resources that women have in the way I entered the variable in my HRA. Yeah, so that is how my sample looks like. So 45%, majority of them were white women. And actually this is also the same with studies that have looked at this population. And then majority of them were 36, that's the average age of the women. They were also married, and I think this is expected because it is likely that married women would likely go to the police because of, custody issues. They are probably having legal issues with their partners. Most of them reported physical violence. Sexual violence maybe could be there, but many times people would not report sexual violence because it's justified within the marriage, so they would not take that as a form of abuse. And so majority of them had more support from their family as well as parents, which is part of their family network. And for the coping strategies, more women used, they were willing to ask for help. And also one of their coping strategy was, another good coping strategy was having been able to survive past trauma. So majority of them reported mental health symptoms. This is actually much higher compared to women who are seeking help from domestic violence shelters. But then this I would interpret carefully because the measure of mental health symptoms in this study could be different from the studies that have been conducted in domestic violence shelters. Yeah, so these are my findings. So I wanted to see how demographic risk factors relate with mental health symptoms. So only ethnicity was significant. And as you can see there, the category of others actually, which included people who are coming from other countries, like refugees and immigrants, they had a significant percentage of mental health symptoms that they reported. And interestingly, as I said, I created a mid-split for women who had few and more resources. So as you can see there, for women who had more resources, they actually reported, let me see. For women who had few resources, they reported more mental health symptoms compared to women who had more resources. So that's very, when you're looking at even the theory, you'd expect that if they have more resources, then they would report less mental health symptoms. And it was the same also for coping strategies, and these differences were significant. So based on the type of violence and also mental health symptoms, I did not find any significant findings for that. But as you can see there, for women who have experienced sexual violence and combined violence, they are likely to report more mental health symptoms because the impact of experiencing sexual violence is likely to have on psychological well-being is higher. Yeah, so these are the additional analysis that I conducted, the hierarchical regression analysis. So as you can see there, African Americans, that was significant, and actually for African Americans, they reported less mental health symptoms compared to other ethnicities. So there could be other ways that they're using to cope with that situation. Is time over?
No.
How many more? Okay, 5 more minutes. Okay. So they could be using more ways in coping, such as spirituality, or maybe the measure that I used for this study could have been is not capturing the actual mental health symptoms that they are likely to report. And here for women who had social support actually predicted more mental health symptoms, which was also very interesting. And it could be that maybe it's better to measure the quality of social support that women receive, or it could be that the social support that this population of women receive is no longer working for them. It's probably maybe they have experienced severe and ongoing violence, and maybe their friends and families have given up, or maybe they are tired of just hearing from them about all this. And so, and that can lead to increase in psychological distress. And so coping, so what I did, there are several stages for you to be able to conduct a mediation analysis. So for social support and economic resources, the variables were not correlated with mental health and IPB. Only coping strategies was related in the correlation analysis. And so that's the only variable that I tested for mediation analysis. And as you can see there, what that says is that IPB is likely to influence coping strategies as well as mental health symptoms. But then when I added coping strategies as a mediator, it decreased the mental health symptoms that women had because the relationship between IPV and mental health was no longer significant, meaning that coping is an important aspect of women that we should really look at in the way we can enhance for them to be able to cope with their experience with violence. So these are some of the limitations of my study. So the extent to which these symptoms might have existed before was difficult to capture, and maybe these symptoms are not likely just because of their experience with violence, because also in the case file there are also other needs that women reported, like lack of transportation, lack of counseling, lack of employment, and things like that. So that might have actually contributed to their mental health symptoms here. And of course, methodological issues for my study, because I was just relying on case files that have been actually designed by, they were not designed by a researcher, but a practitioner. But still, that there was practice validity in that, because the practitioner has worked with this population for 20 years. And many of the things that she had included in the case files is actually what research says about this population. Okay. So, and also I eliminated so many case files. And there was no way for me to know who reported, whether the women reported themselves or a friend or a neighbor or parent, because that could also have given some information in the way that they are wanting to cope with their situation. Okay, let's see. So I think one of the major strengths with my study is that it provides, I would say, it provides information for this sample of women that we could probably continue to build on, especially when we are looking at or working with our criminal justice system, and especially the police station. Most of the times, who are the first responders within they are like the gatekeepers within the criminal justice system. If there's a way we can empower police to be able to respond to individual cases of violence, it would really contribute a lot in terms of improving their health and well-being. Let's see. Do I still have more time? Okay. So another major implication for research is really, I think there's also an opportunity, which is actually what I'm working on, in looking at diverse population. Because if you look at my sample, I think I only had 7 people who are, ethnic minority. Of course, I had also Hispanic and Latino. It will be interesting to look at how coping strategies vary between different populations. So that is what the research that I'm currently proposing right now is to collect data and work with women and just see what ways do they use to cope with their experience. One thing also that I would say is coming up from this study is that most of the times the assessments that are used in collecting experiences of women or measuring intimate partner violence or even mental health or even social support, coping strategies and things like that, for ethnic minorities sometimes that does not work with them, because the way they define violence could be different from what the mainstream society defines violence for them. So that is why I'm also in the process of proposing studies where I can collect qualitative data. And the questions that I'm asking is, what are their past experiences with violence, and how do they define their experiences? And also taking that opportunity for them to be able to speak and share about this opportunity, this experience, an opportunity that most of the times they don't get. It would also be interesting to see what are the past traumatic experiences that they have been through and how does that define what they're experiencing now. I think one of the implications for policy is that, within the criminal justice system, the focus, and I have had some meetings with the police department. For them, it's really catching the criminal, who is the offender in this case. So there's not a priority of also looking at the survivors' needs and what is it that can really support them and their families. So I think there should be more focus on that. And also emphasizing on victim-centered programs that recognize individual unique needs of each person, because the way people interpret their experiences are so different among individuals. I think this would also be good information for students to know, to build their different skills when working with these populations, and also knowing a variety of populations and different places that women seek help, and how do these needs vary based on these populations. And also more training on cultural competency, because Columbus actually is very diverse right now. We have different populations that we are working with. I think it would be good for students to be able to have the skills and the tools to work with these different populations. So these are some of the projects that I'm working on right now. I'm working together with the University of Kentucky on multi-college bystander evaluation, and what we are doing with this is to evaluate the bystander intervention program in 26 universities in the United States to see if it works and how it's working. I'm also working with Ohio Domestic Violence Network in seeing what are the perceptions and attitudes of service providers who are working with survivors of domestic violence who seek help because of their mental health and psychological distress. And this is one of the projects that I am proposing. So.
Open up to any questions? Anybody has questions at this point?
Yes.
You talked about, just saying that, like, the demographics of these people were a lot different than the shelters. I was just wondering, like, what area was this police station in? Like, was it just an area that was composed? Like, the demographics of that area, was it just different itself?
Yeah, this was actually in the city.
Okay.
Yeah, Arlington, which is like within the DFW, Dallas-Fort Worth area. So I would say it's in the city. The reason I say the demographics could be different is because maybe the women who go straight to the shelters and the women who go to the police would be having different experiences. And they are more likely maybe to be women who seek help more often compared to other populations. Yeah. Yes?
Most of the population in the United States lives in an urban area, right? About 80%. So I suspect that all of the people who participate in your research are in that urban area.
Yes.
Right?
Yes.
Would your findings be slightly or very different if you would take a rural population?
That's a very good question. I think it will be different because also urban areas and rural areas are different in terms of context. For example, this study that I've been working on, this research project that I've been working on with the Ohio Domestic Violence Network, we've been able to go into some of the counties here in Ohio that are in the rural areas. And one thing that is coming up also is that people don't share about their experiences, especially with mental health, because of a lot of stigma that is associated with that. They would rather keep that in their families rather than, report that. And also the aspects of transportation is challenging for people who are living in the rural areas. Some of them have to, drive for 1 hour, or even they don't even have cars to drive. And so I think, and also isolation in the rural areas. A lot of service providers were talking about how people feel isolated. And so those dynamics, I think, could be different.
Yeah, there's a push-pull thing, huh?
Right.
It could be there are more services or resources available in the urban area than the rural area.
Than the rural
I can
areas.
also hypothesize that in the rural area, people know each other better.
Right.
And that neighbors more talk with each other than in an area, urban area, where people are more anonymous vis-a-vis one another. I don't know.
Right, yeah. Thank you. Yes.
Your research that you talked about that you're doing soon or now,
Mhm.
is that going to be affected at all by this Title IX reversal type thing that just recently happened? Like, as far as the way college campuses are reporting and handling accusations of sexual violence and stuff like that? Or is that, like, you said you're doing something on campus,
Yes,
right?
yes,
Is
yes.
that going to affect it at all?
Most likely it will not, but because we're in the process, it's actually bystander, evaluating the bystander intervention. We have already collected the data, but still I see in a way, overall, it affects the work that I'm doing. Yeah, because it interferes with the way that people are able to report or even to seek help.
Yeah.
Yeah.
Okay.
Yeah. Yes.
So you said that women coming to the police department, did that also include calls out to their individual homes? Or did they have to actually come in and file a report, or how does that work?
So what happens is that the police are called, and some women actually call themselves. So some women are offered this opportunity to come to the victim assistance program so that they can be referred to more services. So the sample that I have here was only for those group of women who are willing to come, which is a strength actually in its way, who are willing to come and be referred to other resources. Yeah.
What does that, going to the police is in itself kind of not a coping, a response mechanism. Is there, what are the differences that you would hypothesize about the difference between the population that you're sampling that is coming to the police versus the mental health and coping abilities of the population of the large population of women who don't end up reporting? So what would you see as being some significant differences or between that you see in your current population that you're perhaps not able to see in the population that doesn't come forward?
Yeah, I think the differences would be that this population that is coming would probably report more coping resources, different ways that they are able to cope. They would also probably have less mental health symptoms compared to those that do not seek help. So that is how I would predict, because those who don't seek help, and it could be different. It could be actually those who don't come forward have probably found ways of coping with their, with their experiences, or they are probably, looking for different strategies to be able to stay in their families. So, yeah, I think that's a good question to think about. Yeah. Yes.
Thank you for your informative presentation. I'm intrigued by this notion of courage. So could you elaborate a little bit how you measured that? Is there anything specific about courage you could share with us that you found in the study?
Yeah, so what happened is that the victim assessment form had this list of ways that women cope. And so courage was one of them. So, yeah, and these actually had been designed by the practitioner who works there. And And the way I would look at it theoretically is just a measure of coping strategies that people use. Just the courage also to be able to come and share their experiences and be referred to resources, because domestic violence is a very stigmatized social problem. And people feel ashamed that many women feel ashamed that they're even experiencing it. So courage is one aspect of just being there for them to be able to get out of that and to come and seek help and be referred to services. I think that's how the practitioner actually had conceptualized that. Yeah, I don't know if I have answered your question or no.
Because then you would think that they would all score the same.
Mm-hmm.
Because all of the ones in your sample did come and did fill out the victim assessment form.
Mm-hmm.
So was there variation in courage within your sample?
So I did not do individual variation for each person, but I think that's something that I would also look at, how each person, the percentages in terms of each individual, in terms of courage. Yeah, I did not run that analysis, but that would be interesting. Yeah, thank you.
I'm curious, I'm thinking about the opiate crisis that we're having and how that might factor into either deficits, because you talked about like having resources helps you cope, but I'm just trying to think through, what does that crisis do in your research area, and how does that impact how you might look at coping strategies or factors that would impact the ability to cope?
Yeah. Actually, that's a good question. I mean, all questions are good. And that came up a lot. It comes up when we are doing the focus group discussions with the service providers. That's one thing that they have observed, that many people are really struggling with: substance abuse, from opioid, from marijuana, heroin, and all that. And this is just a negative coping, mechanism that people use. So I think one thing that I would be interested, and this has actually been done already, is just also working with this population to look at domestic violence and its association with substance use, and probably doing some qualitative interviews on some of the ways that substance abuse probably helps them, because it definitely helps them to cope with some particular situations. So it's just a manifestation of a bigger problem that they are experiencing. Because when we were doing all these focus group discussions, is that before they even think about when women report mental health, there could be something that is already going on in their life, and substance abuse is one of them. Lack of transportation, lack of employment, issues with child custody and things like that. So I think I would definitely want to explore that. Thank you.
Can I ask one more question? Or close it out. But you and I were talking before about some of the challenges of doing research with this particular population. It's a deeply personal issue. I was wondering if you'd elaborate on or talk a little bit about some of the challenges from doing research in this with this population, with women victims of personal violence, and then some of the opportunities. You mentioned this as kind of as a listening opportunity. Elaborate a little bit on that.
Yeah, I think some of the challenges is also because this is a hard to reach population, because not many people want to come forward and say that they have experienced this kind of violence. And also, especially when working with populations that are ethnic minority and they don't speak English, of course you have to look for interpreters. And so the funding is a big issue when you're wanting to do research with this population. It's very expensive also. But I think the opportunities also is for you through research, is using research also as a way of intervention, where you are also providing this platform for people to be able to share their experiences with you. And you can also use that opportunity also to refer them to different resources within their community.